welcome to Loose Cannon, the Civil Liberties podcast. And today it's bioethics and health law with Sascha Callaghan. And Parnell, you know Sascha very well.
Yes, Sascha and I go quite a way back when Sascha was actually studying bioethics and my then colleague introduced us. Sascha is so many things. She's a health and technology bioethicist and a lawyer. She has a PhD in bioethics and she's a wonderful communicator. So she's really able to tease out the complex issues around biotech ethics and regulation. She's done lots of research in fields from mental health and psychiatric institutions through to women and their relationship with the doctors who treat them in the obstetric process. And of course, lately, she and I have been talking a lot about the ethics of the lockdowns and the medical interventions around COVID-19. So really excited to talk to Sascha today and to let her talk to our audience about the nuances that she sees in these areas.
Thank you for having me.
It's great that you're here. So you do tweet quite a lot about issues around the restrictions that have been put in place to combat COVID. So tell me a bit about you. Actually, you know what? I'm going to read out. So you wrote, ultimately, the decisions are about risk tolerance and balance. Those things are for the community to decide via the democratic process, not by experts or officials of any kind. In the end, the right response / level of risk is a matter of opinion, depending on one's values. Setting a path where there is passionately divided opinion, even among experts, I expect emergency management experts would also end up falling into camps, actually requires political leadership. Far from being no time for politics, it is the time for politics. It's the biggest reckoning of social values, right down to how much lifestyle is worth sacrificing to prevent death, what do we really mean by health, etc., in generations. And you also wrote, much has been revealed about the Australian character. Please discuss, Sascha, what has been revealed about the Australian character?
Well, I mean, I think, we have often liked to think of ourselves, and you still hear this idea repeated, that we're sort of a larrikin nation of, sort of anti-authoritarians. But I think the evidence across many generations, and, apart from a few short blips every now and then where we have had, for example, say Labor governments, I think the Australian population is pretty conservative. There's a very old Henry Lawson poem called Sweeney, and in that poem there's a drunk in a bar, in colonial New South Wales in a pub, and he's complaining about his life and how it turns out, and he says, and I was damned if I could think of what the government was doing. And we are a nation of people who like to be governed. We like to be governed. We expect governments to look after us. And we have high expectations of our fellow citizens that they'll fall into line, and I think we've seen that over the course of COVID. We also, I think we're suspicious of artists. We're suspicious of tall poppies. Where we can be xenophobic. It's sort of all it's the other side of the Australian character, sort of the less attractive side in a way, that has really come to the fore, I think, during this pandemic. And one thing that I think has been quite interesting, especially on Twitter, for what started off as quite a small crowd of people who were suspicious of increasing authoritarianism or tendencies to authoritarianism that we were starting to see, was it was this really strange coalition of, you know, Green voters, artists, you know, trans people, and sort of people who you'd normally think of as being quite a long way down the, you know, the political right, all agreeing that all of this kind of citizens policing each other, you know, mass policing of people going about their ordinary business was something to be worried about. So it was this interesting coalition of people who were probably unusual characters in their own ways, sort of saying, you know, I feel uncomfortable about this level of conformity being demanded. So I thought that was fascinating, and that voice is only growing louder, and I think we've seen that. I think we've seen, you know, the public sentiment tip in favour of reducing the level of government control over our lives. It's been a while coming.
I wonder if we've seen the measure of how much control Australians will take, though, Sascha, in this time, because I think you and I were both really shocked, and I know Jonathan was as well, really shocked when we saw that survey which showed that 60%, around 60% of Australians didn't want borders to reopen anytime soon. And that was around the end of last year.
I think it was more than 70%.
Oh, more than 70%. It was a huge number, huge. And we were very shocked, because it showed us that there was a sort of a sense in the population, a whole set of the population who we didn't feel in alignment with. And yet I feel now that what's happened is Australians have changed their attitude, and it's probably flipped the other way, that now, you know, and I haven't seen any statistics around this, but now people are much more inclined to want to open up. Is it, I wonder, have we just sort of worked out the pace at which the Australian population moves through this, the arc of acceptance in a situation like this?
Are you asking whether I think the pace has accelerated of our?
Well, no, I guess what I'm saying is, do Australians just have a different arc? So the US, obviously, they are very, very trigger happy, very sensitive to any removal of liberty, and their first response is to kick back against any sort of removal of those freedoms, whereas Australians are more likely to have a slower response to it and say, well, okay, we can cooperate for a while, but enough is enough at some point. And I don't know, maybe the UK sits somewhere in between the US and Australia on that, and other countries could be mapped.
I think part of the trouble is that we in this country don't have a great political tradition of talking about freedom as such, and sort of freedom discourses sound very American to Australian ears, and they're associated with all of those things, like, you know, in the Australian mind, with things like mass shootings, you know, and the excesses of Donald Trump. And, you know, most Australians regard those sorts of things with a level of horror. So I think talk of freedom is regarded with suspicion in this country, and we don't have an established discourse here that's taken seriously, sort of amongst centrist people, where we're able to talk about freedom in a way that is taken seriously. We've really taken it for granted, in fact, in this country. And perhaps I think for the first time, we've encountered what it actually feels like to be deprived of freedom, and it probably is the first time Australian-born people have, or even people who say haven't got parents or grandparents who kind of passed down stories of authoritarian type situations, through, I guess, family folklore. So we've got, I think this is the first time many Australians will have experienced what it means to be prevented from doing the sort of normal everyday activities that people do. And that's new for us. And I think it probably has led many people who wouldn't have thought about it before to be thinking about concepts of freedom for the first time. And by many people, I mean ordinary people who aren't especially politically engaged.
Yeah. Sascha, I'm going to throw some of the things that really make me mad and about health bureaucracy and just bureaucracy in general. And I just would be interested to hear your thoughts. So, so let me tell you, in the early stage of the 2020 lockdown, do you know what they did at beaches like Clovelly Beach? They decided that to keep people 1.5 meters away from each other. Now, I don't know, they were going to take some very serious steps. Now, and I don't know about you, but when you have a large open space, people do not normally come right up against each other and stand right next to each other. Like, I would call the cops if someone behaved like that. Yeah. So, but in a big open space, there isn't, like, from my point of view, to have social distancing, there isn't any intervention required. But they decided, the council, that they needed to act urgently, I guess on the basis of the state health orders or whatever. And what do you think they did? They put up fencing and barriers to channel people into one entry point into the water and one exit point from the beach. In other words, treating the open area as though it was a crowded airport. And so what was the effect? The effect was to force people closer together than they ever otherwise would have been, thus achieving the exact opposite of what they said they wanted. Now, do you have a point of view on how public health bureaucracy has gone on in the last 18 months?
Oh, look, I mean, Australia is not the only country in the world who has a bureaucracy that often enacts policy in a clumsy and stupid way. I think that is what bureaucracies the world over do. And, you know, there were many examples of that early on in the pandemic, and that will no doubt continue until the end of time here and everywhere else. Yeah. I think there were a number of things going on. I mean, it was a completely unprecedented situation. We didn't have a lot of information in those early days, but so in terms of how to manage it, I mean, I think there was quite a bit of just flying by the seat of our pants. And even, so that's just at the level of policy setting. And the next question is, well, how are we going to police that? Like, should we even bother policing that? Or should we just say, well, that's the idea and, you know, can you all please do that? So, you know, there's a lot of politics going on and a lot of optics and trying to keep the population, I guess, on side. I mean, in many ways, I think those were sort of failures of leadership in some ways, because, you know, governments were just worried about, you know.
Yeah, the bias was to do something rather than nothing. But
well, this is the thing. We often say pandemic theatre in a disparaging way, but actually sort of early on in the pandemic, it was pretty much everything we had to make people feel a little bit more secure was the theatre around this is how we're managing the pandemic while we know sweet FA about what's going to happen.
Yeah.
Yeah. But can I ask?
They were the only tools. Yeah, go ahead.
Can I ask about another one that makes me mad? This is more medical system stuff. So someone's wife is dying of cancer. Too bad they don't get to be with their dying wife because the rules are the rules. It would be so bad if she got COVID, in her, I don't know, last hours of life. Same applies if you're talking about, the 95-year-old lady with dementia who doesn't understand why nobody's coming to see her in the home because and just deteriorating from the isolation because, oh, no, it would be so terrible if, and I think every thinking person knows the idea that there's no possible way that you could spend time together without risking COVID on everyone else nearby is nonsense. That if they spent 5 seconds on it, they would come up with a way. What do you think about that? Am I reasonable to be mad about this kind of thing?
Yeah, I mean, I think, we could all agree that those examples are the great tragedies of the pandemic. I mean, there were terrible, really barely justifiable, frankly, if at all, decisions made, incredible inflexible application of the rules. Again, that's what happens when you have bureaucracies, implementing these decisions which are taken at a broad level. In individual cases, you see incredible injustices happening all the time. And that's really the price you pay for having sort of policies which really interfere very strongly in the normal running of people's lives, in the normal humane interactions that we have with each other, being with loved ones when they're sick and dying, reuniting babies with their mothers. That case of that 3-year-old had been on holidays with his grandparents in northwest New South Wales, far away from any population centre, and was stuck there when the border closed, and couldn't get back to his mum. Hadn't been anywhere near a population centre with COVID. Meanwhile, exceptions were being made left, right and centre, for other people. I mean, there are examples abound of, unjustified violations of human rights. They happened all the time. And so the sooner those restrictions go, the better and safer we all are, if not strictly in a biomedical sense, certainly in terms of our human rights. Of course, our health is part of our human rights, but health is multifaceted. I mean, health is not just, the biomedical state of having an absence of disease. Health is psychosocial as well. And so really what we've seen is a grappling with that fact.
Is there something wrong with the way, I don't know, medical people are trained that they didn't see this, or is there something systemic we could draw, like some conclusion we could draw from what we've seen, the inflexibility we've seen?
No, doctors are doctors, and we want doctors to be doctors. And by the way, there are many different types of medical professionals involved here. So doctors do clinical medicine. They treat sick people. Epidemiologists, they're modelers basically, and they look at the way that infectious diseases spread, and they calculate risks. And virologists look at the way that viruses work and infect people. Immunologists, look at vaccination. So there's not just one type of medical professional involved here. Do I think that there's something wrong with them and the jobs that they do? No, I don't. They're doing what they do, which is operate in their sort of area of expertise. But what I think we have hopefully learned is that, doctors aren't experts on everything. There wouldn't be a person among us who hasn't disobeyed doctors' orders from time to time, who hasn't decided for their own reasons that they're not going to take the medicine, or they're not going to finish the medicine, or they're not going to change their diet, or they're not going to do this or that, because medical advice needs to be taken in context.
And picking up,
yeah.
Picking up on that, Sascha, do you think that there will be a long tail of sort of medicalism coming out of this? So, you know, now health experts have gotten used to us taking the advice on COVID. Are we going to see measures, harsher measures around other vices, such as eating too much or drinking too much, or, you know, even the odd cigarette, which is obviously something that already the health experts in Australia have been very effective at phasing out? Do you think that there is going to be a sense of empowerment in the health community to, inverted commas, solving other health issues?
Could they not have any greater sense of entitlement and empowerment? I mean, I think the encroachment on health in terms of regulation of our lifestyles is substantial in Australia, probably more so than, you know, almost anywhere else in the world. What I'm hoping to see, and you know, really what I've noticed is more of a willingness to push back on that, or at least to see it in perspective. You know, I think it's a very interesting and tricky balanced strike. There's a famous sociologist called Susan Hart, who I love, and she talks about, you know, striking the right balance between cynicism and scientism. So cynicism is being so cynical about, you know, scientific advances, and let's put medical science and health sciences in that, you know, bucket as well, that you can't recognize, you know, actual facts and the good that is done. You know, you certainly don't want to be so cynical as to, for example, not believe in the effectiveness of vaccines. But scientism, and scientism isn't new to this pandemic. Leaders look to it all the time to try to divert, to try to justify what are essentially political decisions. And that is where you look to science to say, look, this isn't an evaluative decision. This is a decision based on facts because a scientist said so. But that's not what science does. Science cannot give you the answer about what should be done. They can give you information about, you know, the facts involved, but what should be done is a political decision. But we've done this, you know, we do this in many contexts all the time. You know, managers in a workplace, for example, will frequently say, look, what I want to do is restructure the business this way. Now, I don't want to go to the business and say that because people are going to have to be sacked. So the better thing for me to do is hire some consultants, talk with the consultants about what I expect to find, have a report from consultants saying that in their expert opinion, this is what needs to happen, and then that's what we do. So the same thing happens with political leadership.
Yeah, that's why they always have the health officer there, and we're just taking the medical advice, just following medical advice.
But then you can use it the other way, you see. So when it's like, oh, what about the mental health impact? Now, really, it's like, sure, I mean, everyone hates this. What's that? What do you call that when everyone hates something and they're all really upset about it? Well, they call that a mental health impact. So let's get the mental health people out to, you know, and then you have a battle of the experts and you choose which ones, you know, are going to support your cause. But at the end of the day, ultimately, these things are always political decisions. And one objection I had to that article that you sent me, Jonathan, was, you know, that was a different type of expert. That was an emergency management
just to explain, the guy was saying in that article, Ramesh Thakur, he was saying that it should have been emergency management experts, not, you know, health not epidemiologists.
Yeah. But let me tell you, there is not an expert in the world who can tell you the answer to what ought to be done. You know, we haven't had thousands of years of debate over what the right thing to do is. because we could set up a ministry of good decisions and get the experts in good decision management to just tell us what all the good decisions are, because life doesn't work like that. It's multifaceted, and opinions will always differ. So the real ethical question is, where opinions differ, and they will, whose opinion ought to carry the day? And the way that we've sorted it out in democracies has been that it ought to be the opinion of the majority, save for one important consideration, which is, you know, fundamental human rights probably ought not to be subject to the popular vote. So if the majority of people said, for example, yes, I think we should, you know, kill all blue-eyed babies for some reason, apart from the fact that, you know, that's absurd, you know, that wouldn't be something that we'd want to go for. But generally speaking, within certain boundaries, a majority view will carry the day in a democratic system. So let's see what the population wants to do with COVID, and I'm personally seeing a shift.
Can I ask you a question about the experts? Because, of course, there has been, as you've said, an empowerment of experts in this scenario. And I'm wondering what the ethics of experts putting their discipline to the fore, to the exclusion of all other considerations is. And in answering that, what I'm really interested in at the moment is actually the shift to mental health now, because we've been, for the last 2 years, we've been focused on, oh, well, we might die of this pandemic. And now all of a sudden we might all die of the mental health caused by this pandemic. And I wonder about this sort of singular focus which experts are encouraged to push by the media cycle, and how you think that might be managed, or is it just normal and we should allow that and expect our policymakers to balance those interest groups?
I would say I don't actually think that experts really have a lot of power per se. In the end, decisions are still made by elected governments. So that they have the same amount of power that they've always had in a way. The thing is that they've had a platform like we haven't really seen before. So we've got people who are essentially sort of, you know, research nerds that, you know, they all have their own frailties, they all have their own anxieties, they all have their own preferences and agendas. Often, you know, people who are researchers aren't especially good leaders. You know, they don't have training in a broad range of areas. They're only able to give a very narrow opinion in their area of expertise. But what has happened is that in so many television, radio interviews, they get asked to venture an opinion beyond their area of expertise. And of course, you know, like most people with an ego, they're more than willing to share it. And then, you know, an idea has sort of taken hold, or, you know, it's probably always been there, that, oh, well, smart people with an opinion, that opinion, you know, has to be the right one. But the thing is, I believe that what we are slowly learning, what we've seen, what the general public is saying, that only people who previously worked in biomedicine knew before, which is, you know, experts aren't all agreed. You know, experts have different opinions, different personalities. They fall into camps. There's a range of views even among experts. So it came as quite a shock, I think, to the population to see, oh, you know, look at this. There's one group that are sort of hardcore zero COVID people that want to sort of maintain lockdowns and stringent public health and social measures to eradicate or suppress COVID as much as possible in the population. But look, there's another group of experts who don't hold that point of view, and they think that it would be, you know, acceptable to, you know, have more freedom, and all that would happen is that we have more COVID and, you know, yeah, sure, more deaths, but there's no reason why we can't do that, or at least there's no scientific reason why we shouldn't do that. So that was a revelation to most Australians, and I include among that most people who are lay to medicine and medical sciences. So that includes journalists, politicians, and the people listening to journalists and politicians. So that, in some ways, I think took some of the power from experts. Before, we were flummoxed about, well, how do we counter the fact that, you know, AusSage thinks that there's going to be, you know, 6,000 cases a week by the end of October, or, you know, whatever the prognosis might have been, and that as a result of that, we need to, you know...
Sorry, what's AusSage?
Not leave up. AusSage. So AusSage is a group of epidemiologists that are famously risk averse, and they've made a number of disastrous predictions which haven't come to pass. And the Burnett Institute, which is the primary advisors to the Victorian government, are in that group as well. So they tend to be much more risk averse, and their modelling has shown, largely because they underestimated the effect of vaccination, their modelling showed much more dire health outcomes that actually came to pass, particularly in New South Wales, for example. So I think a degree of not cynicism, but scepticism has emerged, which is a healthy scepticism amongst, and I'm not talking, you know, about people who are, you know, complete cynics and deny science. You know, that's a very dangerous phenomenon as well. But amongst centrist, sensible journalists and policymakers, to actually apply a critical eye to expert opinion. And before, I don't think we had the language or the analytical tools to do that in mainstream journalism in this country, or even in politics. And I think we're getting those balls.
What should I say to my friend who said to me, if people aren't vaccinated and they get sick from COVID, they should pay for the medical treatment themselves? Like my sort of lefty response is, well, we have a public health system. There are limits to what we should be, limits to the control we can put on people. We should just accept that we're going to pay for people to get sick, even if they make bad decisions, like when you get drunk and you break your arm. Is that a good response? Or what should I be saying to someone who says, look, people aren't vaccinated, should be punished like that?
I mean, these things have been raised frequently for generations. You know, should we offer health treatment for free to smokers? What about fatsos? What about, you know, people who don't take medicines properly? And we've decided that as a humane society in this country, that we allow humans to be human. We allow humans to live in accordance with their own values, and to make decisions within law. In fact, when they, you know, don't act lawfully, and we don't administer healthcare on the basis of whether or not they comply with doctors' orders. That's a moral decision that we've taken. Sure, you know, there might be other views out there that anyone who doesn't live a healthy lifestyle doesn't deserve free medical treatment. But I just can't imagine that point of view really succeeding in the population as a whole. So sure, I'd say your friends are entitled to their view, but maybe they might want to think about, you know, whether they drink sugary drinks, or, you know, whether they could lose a bit of weight, or whether, you know, there's any number of things that contribute to their poor health outcomes, and whether they might also be denied healthcare on that basis. That might let them to reflect a little bit.
Yep. So, I mean, if there was one thing that I wanted to follow up a little bit, Sascha, it's about, it was because of your work in the mental health space. It concerns me that we're going down this path of increasingly medicalising mental health off the back of the pandemic. So it's become the great mental health crisis. And I wonder whether there are consequences of that could end in an ethically poor outcome. So either because people are pushed into an identity that then becomes theirs, that then makes them less healthy, or because it ends in being scheduled, which you've written about at length about the issues of scheduling and then releasing yourself from that mandatory psychiatric care.
So you're asking me about medicalising...
medicalising the problems of normal life. Yeah.
Yeah. Look, I guess when I think about this sort of thing, I think, well, what are the real impacts of this sort of thing? So, I mean, do I think that it's likely that people are going to be scheduled because they're suffering grief or something like that, and it might be, you know, considered to be some kind of grief disorder? I don't really think that's realistic for a number of reasons. But do I think that philosophically it's a problem to medicalise human experiences? I mean, I'm just inclined to think that it helps some people to think about what they're experiencing in medical terms, and there might be some pathology. I mean, generally speaking, people who tip over into a pathological type situation are experiencing something that's kind of different to, you know, like a layperson would recognise, okay, there's something sort of going wrong here. But for the rest of us, I mean, I think we listen to all of these opinions about, you know, how we're dealing with things at different times. And if it just seems silly and it doesn't resonate, well, you kind of ignore it. But if it's going to work for you, if it means you're going to, you know, have a counsellor that might help you through it, or, you know, access to antidepressants, which actually really work well for people in lots of circumstances, you know, I think it's not a problem. I mean, maybe we encourage people to feel helpless sometimes. That might be what you're getting at, and we're not encouraging people to be resilient. But these, in my view, are part of a conversation that we are having as a community about health, and we'll continue to have it. And, you know, these are very good points that are made about whether we help people more to pathologise their experiences, or if we help people more to encourage resilience. And, you know, I think that actually it's impossible to say in any kind of blanket way. We're all really different, and some people will be helped more by a certain way of looking at themselves, and others, you know, not as much. So I think we have to treat people as individuals.
Yep. So fascinating. Thanks for joining us on Loose Cannon, and I'll put Sascha's Twitter in the show notes if she's okay with it.
Yeah, that's
and
fine.
Please do get in contact with us. The email address is loosecannonpod@gmail.com. This and also Parnell's Twitter is going to be in the show notes, and we'd like to hear from people on guests to have on and things to talk about. See you next time.